Today we'll discuss the adverse effects of cephalosporins. In adverse effects of cephalosporins, the most common is the diarrhea, and diarrhea is more common with the cefoperazone. Most commonly, diarrhea, and diarrhea is more common with the cefoperazone because the cefoperazone, large fraction of cefoperazone is excreted through the bile. That's why diarrhea is common. Now, next is the bleeding. It is due to hypoprothrombinemia. Hypoprothrombinemia, which is more common in the malnourished patient. It is more common in malnourished patient, and the drugs which causes this bleeding or hypoprothrombinemia like cefoperazone, cefotitan, cefmandol, this can cause bleeding. There is a chance of bleeding due to hypoprothrombinemia. Hypoprothrombinemia. Now, how will you prevent or how will you treat this bleeding? By concurrent administration of vitamin K. You can give vitamin K 10 milligram twice daily. This is how you can prevent bleeding. Now there is a chance of low WBC count. Low WBC count with the cephalosporins. Okay. Then there is a chance of pain at the injection site. Pain at injection site when it is given intramuscularly. When it is given intramuscularly, there is a pain at injection site or low WBC count or the disulfiram like reaction. When it is given in an alcoholic person, there is a chance of disulfiram like reaction, and it is reported with the cephalosporin that contain the methyl thiotetrazole group and most commonly seen with the cefoperazone. It is most commonly seen with the cefoperazone disulfiram like reaction. Disulfiram like reaction with alcohol. It is reported with the cefoperazone. Okay. So these are the adverse effects of cephalosporins. Now we'll see the uses of cephalosporins. Where we can use these cephalosporins. Cephalosporins are used in gram-negative infection. Where we use in a gram-negative infection like urinary tract infection, respiratory tract infection, soft tissue infection due to gram-negative organism, and all these infection will respond to the third generation cephalosporin. Gram-negative infections like UTI, upper respiratory tract infection, lower respiratory tract infections like pneumonia, or soft tissue infection, skin and soft tissue infection due to gram-negative. They are treated with the third generation cephalosporin. For surgical prophylaxis, cefazolin is preferred. For the surgical prophylaxis, which is the drug of choice, first generation cephalosporin, parenterally cefazolin. Why? Because longer T-half, better tissue penetrability, and it is effective against microorganism which causes wound infection. That's why it's a drug of choice for the surgical prophylaxis. How will you treat gonorrhea? Gonorrhea is treated with a single dose ceftriaxone, 250 milligram. It's a drug of choice for the gonorrhea. Then meningitis. Meningitis is treated with H. influenzae. Meningitis is treated with ceftriaxone or cefotaxime because of H. influenzae, Neisseria meningitis, and Streptococcus pneumoniae. So in that conditions, we have to use ceftriaxone or cefotaxime, third generation, because it can cross blood-brain barrier. It can cross blood-brain barrier and it can treat H. influenzae-induced meningitis, Neisseria meningitis, and Streptococcus pneumoniae. Or you can also treat the Pseudomonas meningitis. If it is a Pseudomonas meningitis, the highest activity shown by the ceftazidime, and you can add aminoglycosides. In case of Pseudomonas and meningitis, it is treated with a combination of aminoglycoside along with the ceftazidime, and you can treat mixed aerobic anaerobic infection. And nowadays for the typhoid, it is used as an alternative to the ciprofloxacin. Mostly it is treated with the ceftriaxone as an alternative to the ciprofloxacin. or nosocomial infections. It can be treated with the third generation cephalosporin or hospital acquired infections. Okay, so these are the adverse effects and therapeutic uses of cephalosporins.